just to share with everyone some of my experience with dealing with patients who are, whether it's being ruled out for COVID-19 or actually positive for COVID-19. I am a healthcare worker and respiratory therapist, and we are pretty much at the forefront of managing and dealing with COVID-19 patients. Now, unlike my colleagues, personally, I have to say that I have zero fear dealing with these patients. And the reason being is because some of the principles that I've learned from and the application of the Buteyko breathing method. Because I understand the importance of nasal breathing and how it has a tremendous protective barrier to exposure to viruses, bacteria, and what have you. So yes, I apply wisdom and I do wear my mask, but that's not what I totally rely on for my total protection. And as I was explaining during our session, wearing a mask, you may have a sense of breathing more so through your mouth, but it actually, for me, it becomes almost like a breathing exercise, because I'm using the mask, one, to help increase my awareness of my breathing. Two, it helps to promote decreasing my breathing. So really, I kind of reframe the whole situation and circumstance of me just doing a breathing exercise and focus on decreasing my breathing, and also nasal breathing, because I know that is my number one protective mechanism from COVID-19 or any other virus or bacteria that you can speak of. And so when I'm managing and in the rooms with my patients, I don't have to be fearful and treat them with fear like they're a leper, but I treat them, I have the ability to treat them with compassion and really identify and really relate with them as a human being in person without the fear factor, so that way I can maximize their experience and also maybe bring them a little joy, because laughter, joy is healing, opposed to the approach of, well, let me get in there as fast and out as fast as I can. No, I don't mind spending a little more time with them, because I know I have an extra layer of protection that goes beyond just the gown that I'm wearing or the mask that I have on. And so for me, I find that a tremendous sense of value that I've been able to obtain through my training. Managing these patients and dealing with this patient, when you see and look in the eyes of folks who, with this COVID-19, and those who fall into that category that I shared during the session, those who fall into the category that have, prior health conditions, diabetes, high blood pressure, lung diseases, lung problems, the age. Those are the individuals that I'm seeing who are suffering the most and who are most vulnerable to experiencing life-threatening issues and problems with COVID-19. Your average person that, at least in my experience, and even personally, I didn't experience, I believe I had the COVID-19 virus, as I explained during the session, and I didn't feel as though, my health did not degenerate to the point where I needed to be hospitalized or even, do any type of rescue saving procedures. But that's not the case with people who fall into that category from my perspective of what I've seen working with patients. People who have, health issues, they are, because of the COVID-19, they are experiencing life-threatening situations and circumstances where they're needing life support, such as being placed on a ventilator, being given a high amount of oxygen, and even the high amount of oxygen is not able to help these people. So which leads us to, once again, the importance of prevention, because with this COVID-19, we're experiencing that everything that the hospital is throwing at these patients, whether it's medication, oxygen, and even life support, for those who fall into that category, those are the folks that you see on the news that are dying. They're being given everything that the hospital is able to offer, and that's still not enough. And so once again, it speaks to the importance of really and bringing to the forefront of prevention, and as well as early stages when you have this, if you were exposed, early stages doing things that can maximize and support you not your health decreasing to the point where there is no return. Even if you're in the ICU, even if you're under the care of medical doctors, that's what we're seeing. Doctors really just throwing their hands up in the air and saying, there's nothing more that we can do. And so here's why we want to bring this information to the communities, is that there are some things that you can do prior to getting to that point. But if you don't have the information, you have no chance. But if you do have the information, then at least you have a fighting chance before getting to that point, even if you fall into that kind of category. And could that alone, addressing these things in prevention and using principles and precepts prior to at the early stage, having this information readily available to you so that way you can apply immediately, is one of the key things that you have control over. But if you don't have the information, you can't apply it. You can't teach what you don't know, and you can't lead others where you're not willing to go. And so not only is this important for you, but also important for your family members that may get exposed, or your family members that have an opportunity to prevent from getting exposure or succumbing to the harmful effects of this COVID-19 or any other. And so this is really the perspective that we're coming from. These are the things that I'm seeing firsthand, taking place behind the curtain, in the front lines of our battle against this disease. And so we totally understand, and I totally respect and understand why people are scared. They need to be. But you don't have to live in fear. There are things that you can do to support having to just succumb to fear and living your life accordingly, according to that mindset. And so that's why I don't live in fear. I live my life. I take the necessary basic precautions. But with the Buteyko method, I find we're providing the necessary precautions that go beyond just the basics, to provide that extra layer of protection, so that way you don't have to just live in fear and feel that your only recourse is having enough cleaning material or the proper mask to protect yourself.